The Black Women's Agenda was founded in 1977 to generate awareness and support for the issues that secure, advance, and protect the rights and well-being of Black women and their families. In March of 2014, the Black Women's Agenda and the 21 national collaborating organizations launched Because We Care. This is a series of forums that the Black Women's Agenda formed to give resources to Black women and their families on caregiving. So far, we've had 15 forums across the country and another dozen slated to take place in the coming months. Together, we have raised awareness around the issues of caregiving, but we want to do more. And so the Black Women's Agenda has asked you here today to pick your brains. We want to hear about your best practices, your resources, contacts, and other things that you've learned, and we want to leverage your insights, your intelligence, and to frame the conversation for action that will assist and empower caregivers. Our first conversation is devoted to physical, mental, and emotional impact of caregiving on the caregiver and the families. Joining me in the conversation today are members of our collaborating organizations. They will introduce themselves, starting to my far right.
Good afternoon. I'm Elcito Bradley, the president of Chi Phi Sorority, a professional nursing organization.
Good afternoon. I'm Shirley Kaysen Reed. I serve as the international president of the Women's Missionary Society of the African Methodist Episcopal Church.
Hello, I'm Shelley English Figueroa. I'm with Mocha Moms Incorporated. I'm the co-founder and president emerita.
Good afternoon. I'm Sharon Bridgeforth, National President of the National Association of Colored Women's Clubs Incorporated.
Hello, I'm Glenda Newell Harris, National President, The Links Incorporated.
Good afternoon. I'm Sandra L. Gatson, International President of the Women's Home and Overseas Missionary Society of the African Methodist Episcopal Zion Church.
Now, research indicates that just by being a caregiver puts one at an increased risk for high levels of stress and depression and lower levels of well-being of physical health. And statistics show that ethnic minorities provide more care and use less formal services and report worse health than our counterpart white caregivers. There was recently an article in the New York Times that said that African Americans rarely even use hospice care. So how are we coping? Are we coping? How do we get in shape to be caregivers? How do we get to be stronger and better suited to do this job?
I took care of my mom for about 7 years. And so I got up, that was the first thing I did for myself in the morning, was I went to exercise. And it just kind of got everything flowing. And then I was able to then go on with my day to care for her. And I found that to be a great outlet for me. It was also very social. And I think that having the opportunity to be with others when you're caregiving is so very important.
One of the things that we stress with our women, it's okay to be the caregiver, but you also have to take time for yourself. You have to be in the place to utilize the resources that in the community that will also allow you to also have a life.
And Elcito, what do you see with the nurses? Do you sort of have a firsthand look at how we are coping or not coping?
One thing that comes to mind is the nurse in the family. When she has the opportunity to provide care, the rest of the siblings in the family usually look to the nurse and say, "You're the nurse, you do it." And that isn't particularly fair to the nurse, who is the family member. So what we have learned to do and what we do is to say to the family members, this isn't just the burden of the nurse, and we share by training the other family members on what to do. And as part of our organization, we're divided into 5 different regions throughout the country, and we have as one of our national programs, Caregiving, partnering with Black Women's Agenda and AARP. And we go in and we train family members. We talk to them about resources. We say to them, it's okay that you take a vacation and that you don't have to feel guilty about it because you're leaving mom or dad or whomever the person is that you're caring for, because your health, physically as well as mental health, is also important.
So Dr. Gatson, when you see your patients who need care and you see the caregivers that come in with them, what advice do you give them?
First of all, I question what their support system is. Do they have those that are around them that can be supportive in their families, perhaps in their church, in their community, that can help them, to give them some time out, et cetera, et cetera? What I have noticed is that often the caregivers tend to, for lack of a better word, break down because they have spent so much time with taking care of an individual that they don't take care of themselves. And that happens in many instances because of not being aware of resources. There are a lot of resources out there. For example, there's the Family Medical Leave Act. With that act in place, would be able to leave their places of employment to take care of that individual. A lot of people are not aware that that actually is available, and it's within their rights to be able to have that done. But it's very important to be aware of the resources, and often the providers aren't aware of the many resources that are available for them to utilize to be of assistance.
Do you ever stop and just wonder, am I treating the right patient?
You know, one of the things that I'd also like to point out is that we as African Americans, and I love us, we have a very unique and very different way of how we take care of our family. We tend to be ones that like to keep the family in the house, and that's very, very, it takes a lot of wear and tear to be able to manage and to do that. And I always encourage families, as well as my own, that we need to be looking for additional resources. And a lot of times what happens is mom or dad only wants you. They don't want anybody else there. And so there's that emotional burden and that personal burden. But I live 2,500 miles away from my mother. And we have been very, very fortunate that we've been able to find someone that comes in and cares for her. And I'm actually a little jealous sometimes about her relationship with her caretaker. And mom's very independent. But this wonderful lady comes in and helps her, and they're buddies. They go do things together, and it's a relationship. And I think if we were able to make those kind of relationships and make those happen, it would help to take some of the stress and strain off of those of us that may be the daughter or the son really trying to provide the care. The other piece about this is the mental health piece, and that is, I think, accepting and acknowledging the fact that everybody's depressed. The sick person is depressed, and the caregiver is depressed. Because in particular, if it's your loved one that you're caring for, it's very, very difficult to care for your loved one and watch this happen, someone that's robust and someone that has perhaps cared for you all of their lives, and then you have to watch them in this situation. And so, you know, I'm very much one that encourages us to seek counseling. I believe in counseling. I think it's important. I think we must destigmatize this whole notion of counseling. And one of my initiatives as the new president of the Links is mental health. And part of that has to do with the fact that I think, as we say in medicine, physician, heal thyself. I need to be able to take care of myself. I need to know how to exercise. I need to know how long I need to be on that treadmill to burn off calories, because I can't even get into a conversation with you if I don't really know. And so therefore, I think I'm encouraging our membership that we need to address our own mental health issues.
But one of the things, Shelley, I wanted to ask you, with Mocha Moms, you all are sometimes sandwiched between your children.
Absolutely.
And your parents.
Absolutely.
And sometimes having to deal with maybe two parents who are ill. and you have your children, where that can be a great thing for your children to be a part of the caregiving, but it also can put stress on the relationship. So can you
Absolutely.
talk to us a little about that?
Absolutely. We're noticing in our membership, they're about 30, 40, maybe some have touched into 50. What we're seeing is that women these days are having their children much later in life. And then at the same time, people are living longer. So we have this tremendous sandwich generation, and the women are very overwhelmed. Our members are very stressed because they have children who may still be in elementary school or maybe middle school or in the turbulent high school years. And then you have a mom or a dad who's in their 80s. And it's difficult. You put your child on the bus, and then you are running around with your mom or your dad the rest of the day, and you're exhausted by the time your child gets home from school, and you're just no good to anyone. And so what we're finding is that we have to support our members more, certainly on the child rearing end of it, because that's what we can do. So we have moms who are close to each other, who live geographically close to each other, and they'll pick up your child from school, they provide meals when you need a meal, and so that's the kind of support that we give at Mocha Moms. But yes, we are part of the sandwich generation.
And on the education side, adult ed and particularly, many persons are returning to school, taking certified nursing assistant courses, home health aid courses to learn the proper way to take care of mom, dad, or even their own children who have disabilities.
Well, it's called working smart,
Yes.
and still taking care of them smartly, intelligently. And there have been resources out there for others that we didn't know about.
That's
So
right.
now we're
That's
just
right.
becoming informed. And we can't claim victory yet,
Right.
but we are certainly trying one meeting, one forum at a time, and hopefully
right.
the people who are not in attendance will be passed on to the others as well. Thank you so much, ladies. This was wonderful.
Thank you.
Thank you.
Thank you.
Thank you.